All right. Good evening, everyone. Yesterday, I had given you homework to revise the bones of the elbow joint, and I'm sure you must have done it. Let's go back and have a look at the image. All right. This picture from Netter's Anatomy flashcards. I had asked you to recognize and revise each and every marked points here or the markings identified. This is the bones of the elbow joint in extension. I told you from the right elbow. This is humerus. And I asked you to identify these markings. Number one, it's capitulum, right? So it's medial, it's capitulum, number one. Number two is the head of which bone? Radius, head of the radius. Number three is the tuberosity of the radius. I kind of gave you a hint yesterday. And number four is the tuberosity of ulna. And this is the ulna bone. So as you could see, elbow is formed with the formation of or the articulation of capitulum of humerus, head of ulna, and radius. And if you look at the posterior view in extension, so these are the structures I told you. This is ulna, this is radius, and this is humerus. And if you're asked to identify number 5, so this is the neck of the radius. We'll discuss the importance of it as well. So this number 6 is the head of the radius. 7 is the olecranon process. With the capitula, if you look at from the behind, this is the olecranon process of the ulna, which is articulating and forming the elbow joint, I'm sorry. Number 8 is the lateral epicondyle. And number 9 is the olecranon fossa, right? So if you look at the formation of the elbow joint, so it is formed by the formation of, formed by the humerus and the two forearm bones, radius and ulna, right? Ulna lies more medially. So this condyle will be medial epicondyle. And this number 8, I told you, is the lateral epicondyle. And radius is laterally. So this is the very important thing to know. When we are sitting with the elbow on the table, so it is this number 7, olecranon process, which we feel it's located posteriorly and on the proximal of the ulna. So this is this part that we feel or that comes across or comes in contact with the table, with the elbow on the table. So what happens? This elbow joint, it's once we're considering all the joints of the upper limb, so other than the shoulder joint and the fingers, it's the third most commonly dislocated joint. So once again, elbow joint is the third most commonly dislocated joint of the upper limb after shoulder and the fingers. And mostly the dislocation of the dislocation of the elbow joint occurs when you fall or when someone falls with an outstretched hand. And the most common or the most popular dislocation is the posterior dislocation. The most common type is the posterior dislocation of the elbow joint. If we talk about what type of joint is elbow joint, so it's the synovial type of hinge joint. So what are the movements which are possible at elbow joint? It's flexion and extension. So these are the bones we're discussing in extension. Let's discuss the bones in the flexion position. And as I told you yesterday, that if we look at the bones of the elbow joint or the elbow in flexion, so this is number 1 in the lateral view. What does it show? It shows Look, 1, 2, 3, 4. 4 things you have to point it out. For ulna, one is, this is the, for ulna, this is ulna bone, and this is the radial bone. Okay. So this is the radial notch of the ulna, radial notch of the ulna. Then this is the coronoid process, trochlear notch. This is the trochlear notch, and this is the olecranon. This is the olecranon part of the ulna. So olecranon part, trochlear notch, coronoid process of the ulna, and number 1 is the radial notch of the ulna, and number 2 is the radius bone. Humerus, ulna, radius. Good. Moving on to the second image. Have a look here. This is inflection. You're looking from the medial view. Medial is towards the midline, okay? So if you are looking at structures here, number 2 is again radius bone. So this is radius bone. This is ulna. This is humerus. Number 5 is humerus. Number 3, look at this. This is the trochlear notch. This is the trochlear notch, right? This is the trochlear notch. Number 4 is the radial tuberosity. Right. I just told you that when you have to consider the dislocation of the joints in the upper limb, the elbow joint comes in the third priority or third most famous. And it's accompanied, most commonly, it's accompanied by the fracture of the epicondyles of the humerus. See, these are the epicondyles of the humerus. Olecranon process of the ulna. This is the olecranon process of the ulna. The radial head or the coronoid process of the ulna, right? And the median or the ulnar nerves of the brachial plexus, they also get injured. Maybe because of the dislocation of the elbow joint or because of the fractures of the radius or ulna or the medial epicondyle of the humerus. So the fractures of the proximal radius usually involves the head and neck of the radius. We discussed the head and neck of the radius, the head and the neck of the radius that mostly fractures. Ulnar fracture often occurs from a direct injury or when you are abusing someone under hold. So there is forced pronation of the forearm, which involves the fracture of the shaft of the ulna. So whenever you're forcing, like you're turning a children's arms or someone's arms who's weaker than you, force pronation, or you're injuring it directly, then it causes the fracture of the ulna. That's how it happens. Right. If we discuss about the ulnar joint, wait, the elbow joint, sorry. One more thing I had to tell you. So we will stop sharing this screen and let me show you another screen, because when it comes to elbow joint, there is another very important structure or the topic that is covered for MRCS A MCQs, and that is cubital fossa. Very important, very, very, very important. So what happens to cubital fossa? If we are talking about a cubital fossa, this area is the cubital fossa. You're looking at the image from the clinical anatomy. Right. What are you looking at? So cubital fossa, very simple definition according to this clinical anatomy book. It's a transition between the arm and the forearm, right? So that's very simple, logical, clicks your mind. and it's situated in the front of the forearm, in the front of the elbow joint. This is the front of the elbow joint. The cubital fossa is a triangular intermuscular space. So this part, it's triangular and it's intermuscular. Intermuscular means in between muscles. These are all the muscles that you're looking at, and they are being labeled as well. See, this is biceps, this is brachioradialis, this is spinator muscle, that's pronator teres, deep muscle, anterior the branches, and the flexor longus pollicis muscle, flexor carpi ulnaris muscle, flexor digitorum profundus muscle. Right, so in between all these flexor digitorum profundus, yes, I just mentioned. And this one is the pronator teres, deep and the superficial heads. This is the superficial head, that is the deep head. Right, let me tell you more. You've already become familiar, I've already described or explained the definition or the name what cubital fossa stands for. But more, I want you to understand the boundaries of the cubital fossa. If we look at the proximally, then there is this imaginary line between the median and the lateral epicondyles of the humerus. And that basically forms the base of the triangle. So if you can imagine, base of the triangle would be here between medial and lateral epicondyles of the humerus, right? This is above the olecranon process that you are feeling. That's where that is. I just showed you in the image. So that is the proximal limitation of or the proximal boundary of the cubital fossa. Laterally, let me tell you, lateral is this way, right? Lateral is this way. Laterally is the brachioradialis muscle. Here is brachioradialis muscle. So this muscle here, brachioradialis, here, underneath. That forms the lateral boundary of the cubital fossa. Medially, come over here, have a look at the pronator teres muscle running obliquely from the medial epicondyle of the humerus to the lateral aspect of the radial shaft. So here you have listened or seen the two. This is the pronator teres. It's coming basically from here. Common flexor origin, it says. So it's coming from here and it has superficial and deep heads. So these are the medial, lateral, and the superior or the proximal boundaries of the cubital fossa. Now, coming to the apex of the cubital fossa. Right, it's the point where the brachioradialis crosses pronator teres. So this is pronator teres, and here below is the brachioradialis. So the point where brachioradialis is crossing pronator teres, that's the apex of the cubital fossa. Now the roof of the cubital fossa is basically formed by the overlying deep fascia, which is partially reinforced by the extension from the biceps brachii tendon. Here is the biceps brachii tendon, also known as the bicipital epineurosis. So the bicipital epineurosis and the deep fascia forms the roof of the cubital fossa. Very good. Now, very importantly, think of the floor. When I'm telling you about the roof, then you have to think that, okay, there has to be a floor as well. Otherwise, why is she sitting and discussing about the roof? So very simply, don't have to confuse yourself. Floor of the cubital fossa is formed by the very important same brachioradialis muscle and the capsule of the elbow joint. Simply. Now, you've already talked about the definition and the boundaries of the cubital fossa. Now have a look at the contents of the cubital fossa. Some of the things are very important because as many as they want, MCQs can come on the relation of the contents of the cubital fossa. Relation of the cubital fossa is very important here, over here. Very, very important. So no matter how you learn it, you must make a key out of it, and you have to learn it so that you don't get confused. Let me try explaining the structures that I can see or I can point out to you. So the contents of the cubital fossa are from medial, very simple, from medial to lateral. If I tell you, is the median nerve. Here, the median nerve is labeled here. So this is the median nerve, medial to lateral. First comes the median nerve. Then comes the brachial artery. See, this is the brachial artery, median nerve, brachial artery. By its, yes, and the tendon of biceps brachii. So if you go from medial to lateral, median nerve, brachial artery, biceps brachii. And if the brachioradialis muscle is here, so it is most lateral. Right, so if you retract the brachioradialis muscle, you'll see one nerve protruding here. This is the superficial branch of the radial nerve, and this is the lateral cutaneous nerve of the forearm, which is branch of the radial nerve. So you'll see this. Right. If you talk about the superficialness, then this biceps brachii muscle and brachial artery are palpable very easily. And once you are feeling the pulse, one can very easily pulsate medial to the biceps brachii muscle, the pulsation of the brachial artery, right? And in the distal part of the cubital fossa, this brachial artery, as you can see, it's being divided into its two terminal branches. This is the ulnar artery. You can see here the label ulnar artery, and this is the radial artery. These are the two terminal branches of the brachial artery, right? And if you look at another in the median nerve, both a lot of MCQs comes when there are questions about the fracture in the elbow region, or when there is a fracture of the supracondylar fractures of the humerus. Supracondylar fractures of the humerus are more common among children. So when when in the conditions when there is a supracondylar fractures, then median nerve, look at here, and the brachial artery, both are susceptible to injuries. They are vulnerable to fractures in the cubital fossa. So this is very important that you have to know. Another very important thing that you have to know. That's why cubital fossa, learning and remembering the structures, knowing their relations is very important. Now, my homework for today for you people is that I want you to remember or recall or study the origin, insertion, and nerve supply of brachioradialis muscle, biceps brachii, and pronator teres muscle. Origin, insertion, nerve supply, action of these three muscles. Let me tell you again. Biceps brachii, brachioradialis, and pronator teres. Pronator teres, right? Their functions, their actions, their nerve supply, origin, and insertion. When I'll discuss tomorrow, make sure you revise the muscles of the forearm. So I'll be discussing the joints and the muscles of the forearm. Then we'll be discussing these flexor digitorum profundus and other muscles of the forearm, flexor pollicis longus, etc. All these muscles. These I'll be discussing tomorrow. So I think that's enough for today. Keep studying, keep revising, and make sure the questions that I ask you, write when you're watching the recordings, write down in the comments the answer so that I know that you people are following. And if there's any confusion or you don't understand anything, or I'm unable to explain anything properly, then ask me again. I'll explain it again. But I cannot tell you each and every MCQ. But remember, every point that I'm discussing is important, and MCQs comes out of it for MRCS Part A. Right, with this, let me end. Good night. Keep studying. Bye-bye.